It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Hi everyone, I'm Sam Lesante. Thanks for joining us. Now today, my friends, I'm at Mountain City Nursing and Rehab Center in Hazleton Township. Now, how many times we have to make a decision as to when do we put our loved ones or maybe you into a nursing home? Well, hopefully today, after we're done with the show, you have a full understanding of what happens at a nursing home. And joining me today is the administrator, Patrice, Shutt, and Theresa Perkowski, who is the mission and marketing director. Girls, thank you very much for allowing me here today. I'm really excited about this show because, you know, when you talk about a nursing home, you know, who wants to go to a nursing home? Okay, nobody, okay? But let's talk about, you know, what Mountain City is all about and dispel whatever positive or negative, you know, let's start fresh and let people understand what a nursing home is all about. Patty, tell me about this particular facility, Mountain City Nursing and Rehab Center.
Okay, so Mountain City Nursing and Rehab Center, we're a 297-bed, two-building facility here. So we have close to right now a little bit over 200 people in the building. And what we do here is we can work with short-term rehab, long-term residents who might not be able to get back home, and we also have a memory care unit. So specifically, today we wanted to talk about our short-term rehab a little bit more in depth for those people in the community that aren't really sure what we provide here.
When do I decide that I have to go to a nursing home?
What you see on TV and read about in the papers never really shows us in a positive light. So this is a great opportunity for everybody to understand, you know, when do you decide to come here? And for most people, it's after a hospital stay. So let's say they have a stroke or they have a heart attack, or maybe they have a fall and break something, and they might need some rehab or just some nursing care to help get them back on their feet again. You know, we're the people that you'd want to come to work with our therapy team to help get you stronger and either back to the community or, you know, another lesser level of care.
In admissions, Theresa, okay, this is when, and my friends, I'm putting up on the screen a phone number that feel free to give them a call. They're more than happy to answer any question, and plus they give you tours. But as an admission director, you see them coming in, correct?
Correct.
Okay.
So as an admission director, we're the first person that resident will meet. We work in conjunction with our local hospital, Lehigh Valley Hazleton. We are very proud that we are part of their PAC skilled nursing facility preferred provider. So if Lehigh Valley has a patient that does require skilled nursing services, they will refer them to the providers that are in that PAC network. So as a credentialed person to go into the hospital, I will go in personally to meet the resident, make sure that clinically we can meet that resident's needs, make sure we have everything that we need for that resident, any kind of equipment that they may require. Like Patty had said, maybe they went into the hospital with congestive heart failure or COPD, and they're on oxygen for the first time. We're going to make sure we have everything ready for that patient coming into our facility. And then that gives the patient the opportunity to ask me any questions that they may have. Because as Patty said, it is scary for a patient. It's very overwhelming for the patient and the family because there's a lot involved coming into a skilled nursing facility. So I will go in, I will speak to the patient, answer any questions they have, make them feel more comfortable. Then they already have a face that they can put to the facility and they feel more comfortable going in. Like, oh, I've already met somebody. She was very nice. She answered all my questions. I feel great about going to that facility.
You keep mentioning the word skill, okay? So let's talk about that. Let's talk about the skill. Who's taking care of my loved one, okay? Who's taking care of me, okay? Let's talk about your staff and how skilled they are. Any one of you.
Yeah, you know, I'm going to talk about our staff, right? Staffing is a big topic everywhere, and I'm really proud to say that right now, all of our nursing staff is our own staff. So there are multiple other places that have difficulty retaining staff or getting new staff. Right now, we have zero agency in the building, which means that the staff that you see are our staff. And the difference behind that is, you know, when you have the same staff member taking care of you every day,
Yes.
they're able to notice, you know, is there something different going on with your loved one? Are they maybe not feeling well? They notice those slight changes before other people may notice. And as far as skilled care, you know, that involves registered nurses. We have licensed practical nurses here, and we have certified nurses aides. So those are part of the direct care team that will see you every day, give you your medicine if you should need some sort of skin or wound treatment. They also are in constant communication with the physicians every day. And then the majority of why most people come here is for our rehab team. You know, we have physical, occupational, and speech therapists on staff, and they're the ones that are educated to provide the correct kind of rehab for whatever ails you to get you back on your feet.
Nothing like having the same person coming in and knowing, because they build up a compassion for that particular person. I think that's critical. Oh, here comes Betsy, or here comes Jim, and they kid around, and they become family.
Yes.
Okay, and that's the thing that, you know, you would want, even if you're going to assisted living home.
As the population of workers gets smaller, it's a little bit harder, you know, to keep and retain newer staff. And we work collaboratively with Penn State and the local nurses aid program,
Yes.
you know, to try and bring in and recruit those newer staff members.
I don't think you'd get the blessing from Lehigh Valley Hospital Network if you were not quality, because they're top shelf, okay? Right. So they're just not going to do that, and that's a major plus. You know, today we see a lot of advances in dementia. We see things happening, but sometimes, unfortunately, people need help, okay? And they just can't manage it. They can manage it to a degree, but it gets to the point where the caretaker is really wiped out, okay? And that's where the hard decision comes. The hard decision comes is, well, maybe we better take my husband, my wife, my whatever, and consider going to Mountain City Rehab and their memory unit, okay? Let's talk about your memory unit. Okay. And what do you do there, and how do you bring solace to those people who really need it, you know?
Okay, you want to take that one?
So first of all, it's a very hard decision for the family member to make that decision to place a loved one in a skilled nursing facility, either for short-term, long-term, or a memory care unit. So I always encourage the families to come and take a tour of our facility. Come and see the dementia unit, our memory care unit, because we want to make sure that the family feels confident and secure that the patient is going to be taken care of. We do offer individualized care plans for our residents in the memory care unit. We have specialized activities for the residents in the memory care unit. Our memory care unit is located in our blue building on our 3rd floor. It is a locked unit.
I would say it's secured,
yes,
right?
It is a locked, secure unit, because we do have residents that are at different levels of care with their dementia. So we have residents that are very mobile. They're able to walk, ambulate in the hallways as they're capable of doing it. And then we have residents who require more care. So the unit is a secured unit.
Now, and that's where I put here, assess the needs. Mm-hmm. Because there's certain people that need certain things, other people don't need that. And I think when you're at home, you don't know what those needs are. Would you agree with me then?
I would, yes.
So that's where you could be really doing a lot better at helping that person by coming to a facility like Mountain City rehab. Am I correct in saying that?
Yes.
Yes.
Yes, you are correct. Because some residents that, do have dementia, they're, like I had mentioned, they are capable of ambulating, walking on their own, and they're confused, which means they have some safety concerns. They might not realize if they get out of the facility, or even if they were at home, that they weren't safe. If they would wander away from their house, they would not know how to get back to their home. Would they try to turn on the stove and not realize that the stove is on and they didn't turn it off, and it would be a safety issue to cause a fire? So we would be able to assess the patients to make sure that they meet the criteria to come into the memory care unit. Some residents that have dementia have behaviors. So then we have more specialized programs with our activities department to help with the residents' behaviors.
When you're talking about special needs, and that's where I think it's key for our audience, if they do need, if there is someone who they feel is, they can't handle. And the safety unit that's the safety thing about being at home. As much as you don't want to see that loved one going to another place, but the point is for the safety. When you're dealing with dementia and Alzheimer's, you said there are different
levels.
Yeah. And what would be those levels?
So for dementia, people who, are at that first level of dementia, they might just have a little forgetfulness. They might recognize your face. They remember you as a friend, but they can't exactly place, who they are. And then you have a spectrum of people who can no longer shower themselves, bathe, get dressed, remember to take their pills. And sometimes when people are at home like that, they forget their pills, they have a fall, they get sick, and really it's just because that level of memory and ability to remember to take your meds or take a shower, it's not there anymore. And it then becomes unsafe, or they get sick as a result of that as well.
Talking about skilled people. Okay, so in the memory unit, okay, you have people who have been skilled and trained, okay, and you have specific activities that they go through, okay. We don't know if there's, hopefully someday there'll be a cure or something for that. Have you seen, in any type of advances in, the care of Alzheimer's or dementia that where a person comes in and that they at one time could go back to their home? Or is it just...
Yeah, sometimes that does happen. So sometimes we may even use what's called respite care, where that caregiver at home needs a break, or they're going on a vacation and they come in for a short period of time with us. They might do a little therapy to help strengthen them or help get their medication regime straightened out a little bit. And then in maybe a month, 3 weeks, they're going back home with their loved one, and they're maybe able to stay out in the community a little bit longer, which is, where they may want to be. So yes, we do see at times where people will rehab that have dementia and then return.
So when someone goes into the memory unit, okay, are they allowed to, at one point in time, maybe if they want to come and take their loved one for a visit, or if they want to go someplace with them, are they allowed to do that?
Oh yeah, and that goes for more than just our rehab unit as well too. Anyone here, as long as their physician has okayed it, we welcome them to go out on pass. Sometimes just a nice trip out to, let's say, McDonald's, or to go get an ice cream, or to maybe visit home for just a little bit.
Yes.
Go outside. Fresh air and sunshine are a great cure for a lot of things. So yes, we do encourage it.
When someone goes into assisted living, then after a while it's like home to them, and it's like, oh boy, it just becomes, which is fabulous, when you have somebody here and they're here and they know they're getting, whether it's rehab, and they feel like this is home to me, and when they leave and say, well, I got to get back because I'm,
Right.
Isn't that, I'm sure you've had some,
Yeah. I mean, I could probably talk about one. We had a young girl on our rehab unit. She was unfortunately in a car accident, and she was with us for about 3 months. And, in 3 months worth of time, the staff who see you day in and day out, along with her family, they became our family.
Yes, yeah.
You know, you get to know and you get to talk with them about what their likes are, their dislikes. And the best thing is to see somebody come in who might need a little bit of help and just can't get there. And then our rehab department and our nursing staff works with them, and then they get to go home. You know, it's great to watch somebody do that. While, you know, we hate to see some people leave, you know, it's good for them. And just to watch that progress is really, it's amazing sometimes. And then still getting to be in touch with the families after they go. You know, we like to do some follow-up calls and check in, see how things are going. And when they tell us things are going really well, it's great.
Oh, absolutely. Especially when they come back and visit you.
Yes.
You know, and say, oh, Jim, how you doing? You know, that's great. My friends, I'm here in Mountain City Nursing and Rehab Center, Hazleton Township. Phone number's on the screen, 570-454-8888. Now, I know decisions sometimes are very difficult to make, but sometimes they have to be made. And when you're looking at rehab and you're looking at dementia, Alzheimer's, etc., not like going to a place that's welcoming, not like going to a place that's skilled, not like going to a place that you can trust, okay? So today, we're trying to highlight what Mountain City Nursing and Rehab is all about, and the skilled nursing they have, the skilled facility, all the facilities which we're going to show you. All right. Now, you mentioned about your medical directors, and you have three of them. You have Dr. Philip Benyo Sr., you have Dr. Daniel Benyo, and you have Dr. Kadia Broadzit, okay? So you have three medical directors, okay? Now, this is what Dr. Benyo had to say about Mountain City.
My name is Philip Benyo. I was born and raised right here in Hazleton, and for the past 45 years, I have been practicing internal medicine in the community. Now, a lot has come and gone over those past 45 years, but one thing that has stood still, like a rock, is Mountain City Convalescent Center. They have always been there when we needed them. For the past 2 decades, I have been their medical director, and I would not have signed up with a facility that I did not believe in and stands behind us. And furthermore, I have 2 sons who practice medicine with me. All 3 of us are at Mountain City to serve you. Give them a call. You won't be sorry.
Well, welcome back to the Sam Lesante Show, folks. I'm at Mountain City Nursing and Rehab Center, Hazleton Township. Now, remember, for those of you who have cable, you know we're on channel 13, 513, 92 in Wilkes-Barre, 190 in Comcast. But go to our website. All of our shows are there, particularly this show that we're doing today. Some of you may not have cable, our YouTube channel. And learn all about Mountain City Nursing and Rehab Center. You're going to be pleasantly surprised. I'm here with Patty Shutt, who is the administrator, and Theresa Perkowski, who's admission and marketing director. Let's talk about your short-term rehab, which seems to be very needy these days.
Sure. Here at Mountain City, we specialize in short-term rehab, which specifically means if a resident goes to the hospital, say for example, they had a fall at home and they fractured their hip, and now they're not able to go back home to rehab, they need to come for a little bit more specialized care for rehabilitation. Again, I will evaluate that resident at the hospital, make sure we have everything clinically ready for them to come to the facility. They'll come into our facility. Our physical therapist, occupational therapist will evaluate them for the most appropriate care for them. So they'll make an individualized plan of care for that resident. They'll see what their prior level of function was prior to coming into the facility. So for example, prior to coming to our facility, was that resident able to ambulate independently on their own, so that we know what the goal is for that resident. So for that resident to be able to go back home, the goal has to be they have to be able to ambulate maybe from their kitchen to the bathroom, or maybe they have 12 steps that they have to do. So then our therapist will work with that individual to eventually every day be able to get to that goal that they need to get to return back home.
Could I feel comfortable? I mean, are they going to get the care that they deserve? And what about your facility? What kind of amenities you have here?
Right. It's scary to bring your loved one here, or anywhere, you know, for that matter. And I know Theresa and I can both say on a personal account, we've both had loved ones here.
Oh, okay.
You know, I'm more than comfortable to bring my own family here, knowing that the staff here are going to help them, help them achieve the goals they want. And, some of the amenities that we have very nice, large, open rooms here for the residents who need to just come and stay. You're coming from your house to a hospital, and the last thing you want to be is in a small, dark, cramped room.
Sterile situation.
Yes. We encourage people to come here, bring some of your personal belongings to make it a little bit more warm and home-like. We also have a dining room. If you want, you can eat meals in your room, but we encourage you, come out to the dining room, socialize. That makes your day go by just a little bit faster. But the most important part for someone to come here for rehab is therapy. Theresa can explain a little bit about the insurances, but your insurance will cover up to 3 hours a day of rehab services, which is really
so important.
That's what you're here for.
Yeah,
You're here to
it.
get better. And when you're here to get better, that's what you need. You need the rehab services, and whether it's physical therapy to help you get stronger and make you walk a little bit further, a little bit longer, or whether it is, learning how to use your hands or, learn to use your feet again the way that you did before. Our therapists are specialized to do that kind of treatment. Our nurses, they are educated and keyed in on signs and symptoms to watch of certain diagnoses. So that way, if they may notice something that you wouldn't know, they're going to notice that. And we also have our medical directors who you don't have to go out to see them. They come here. They're on-siting their patients and physically viewing them. Now, they don't visit as much as a hospital doctor does,
of course, yeah.
But they are here frequently, and they're in touch with our staff on a regular basis.
It's interesting you say that, Patty, because when you're at home, sometimes there's telltale signs that you cannot recognize.
Correct.
That you do recognize here, and that's important for the patient and for the person. And I think that's where you have that skill care. So what does this cost me? Okay.
So if a resident is admitted to the acute care facility, which is the hospital, one of the criteria for a resident to come into skilled nursing to be able to utilize their Medicare benefit is that they have to have a 3 midnight stay in the hospital as a regular admission. Sometimes a resident will say, well, I'm in the hospital, why can't I just come? So on the admission end of it, I will check to make sure that that patient has been admitted to the hospital as a regular inpatient, that that person is not there under observation. Because Medicare, again, the first criteria is for them to be able to pay is you have to be in the hospital for 3 midnights. Once that resident has met that criteria, again, we've assessed them. Yes, you meet the criteria to come in for some short-term rehab. Medicare will pay the first 20 days 100%. So days from 1 to 20, Medicare will pay 100% of that resident's stay here. Resident does allow an individual to have up to 100 days available. Now, sometimes the residents get confused and like we had mentioned before, it's overwhelming because they hear a lot of information on admission and coming to the facility. So they'll hear, I have 100 days available. But it all determines on how that resident is progressing. So once the resident has reached their maximum potential, Medicare will issue a 2-day notice of discontinuation of that benefit. So they're not always utilizing all 100 days. So again, days 1 to 20 are covered 100%. On day 21, there is a co-payment that starts from day 21 to 100, which is $209.50 a day. But if an individual has a supplemental insurance, like maybe they have Aetna, AARP, Humana, Cigna, we will check that for them to see if they have a skilled nursing benefit on there. And if they do, that supplemental insurance will pick up that copay of $209.50 a day. Because it's scary to a resident because they're thinking, how much money is it going to cost me to come in? Now, if the resident meets the criteria financially, we will also assist them with applying for Medicaid if they don't have a supplemental insurance. So that would help them pay for that copay.
So you cover all the bases.
Yes, we'll do all that work for them because like I said, it's overwhelming. It's a lot of information they get in the beginning.
All right, so we're here at Mountain City Nursing and Rehab Center, my friends, and hopefully you get a better understanding of what's about. We have 1 minute left, okay? So why should someone consider, Patty and Theresa, coming to Mountain City Nursing and Rehab Center at Hazleton?
And they should consider coming here because, quite honestly, I think we have the best rehab program and nursing staff around. We have very many good outcomes here where people are, getting better. They're going home. They're staying home for longer. And I think that's most important to a lot of people. You can maybe go rehab somewhere else and they might give you some keys and some tips and some tools. But here we've got the whole package. We've got not only people that are educated, but they're people that care. And I think that really at the end of the day makes the difference in the care you get.
And I applaud you and I applaud everyone who works in nursing homes and healthcare today. It's a difficult task, and you need our prayers, and it's so wonderful to see that even though a person had a stroke or whatever, still feel good about what they're doing. So my friends, the phone number is on the screen. Don't hesitate to call them. It's 570-454-8888. They'll be more than happy to give you a tour. I hope you learned something. Remember, we played the show a number of times. It's on our website. It's on our YouTube channel. I hope you had get a better understanding of what Mountain City Rehab and Mountain City Nursing and Rehab Center has available to you. We'll see you next time.